I have a question for Captain Usha. Ma'am, the emotional well-being of nurses was challenged like never before by COVID, and I can speak from a certain amount of experience because when I was in hospital, this was one aspect that I noticed was very severe. Long hours caring for patients, fears about contracting the virus, separation from loved ones, also being the only link between the family and the patient, and this is very important, A lot of the patients feel that they don't see anybody. They just see these white-dressed people whose faces they cannot recognize.
Yeah.
And they're cut away. So what would you have to say about that?
Sir, unfortunately, I'm not able to hear you very clearly today.
All right, I'll repeat my...
There is an audio problem, but I understand. I just faintly heard you. I heard that, patients and the staff go through a huge emotional roller coaster while being in these kind of units, isolated. If that's what I heard you, then my answer would be that, yes, it's a very, very trying time for all of us, especially for the frontline healthcare workers. They are right there at the bedside of the sick and ailing. And many a times we've seen that the patients are left alone in these units without family, without near and dear ones. And they carry a lot of sensitivities of caring and nurturing to these sick who are there in the hands of very young people who are frontline workers. If you see the young doctors, the young nurses, they are all very young people. It's really, really traumatic to see someone dying. It's, it's hard to say goodbye, hard to see that, families do not know much about the patients while they're in there alone. So I think the whole healthcare workers have been put to immense stress and trauma in this period. And fortunately, the profession has taught us resilience. It has taught us duty, devotion, and care to the people who need our service. But then there is always this fear of the unknown, an impending fear. Do not know what's going to happen next. Young people leaving back their families at home, coming to work. I think it calls for a different DNA to handle the mammoth task that we have all undergone in this past year. As such, representing the nurses of this country, I must tell you that nursing is a very hard profession. And young people coming to work without knowing what's in store for them, without fear. I think we salute the entire workers of this country today for having stepped in and taken charge with courage, conviction, and care and competence, and putting the country back on the map today to say that with great pride that we have handled the situation, we have learned lessons, we will work harder if there is an impending situation like this, and I'm sure we will come out of it strong.
Yeah, thank you so much, Captain Usha. One of the things that I noticed during the time when I was in hospital was there were very early stages of the virus and the infection and the condition that all the patients were landing up in ICUs. And there were many occasions, Pranay, when the patient would desperately ask the nurses, give me something, please save my life. And the nurses were just so handicapped because no cure had been organized till then. And they just didn't know what to do. And there were times, I don't know whether this should be allowed to be spoken, but there were times when they were just giving them an ordinary aspirin tablet to make them feel comfortable because they knew that the patient was not going to survive. And that kind of trauma was actually breaking down these nurses. And they would come and narrate these incidents to us. How do they deal with this, Captain Usha? I mean, is there an organization that deals with the mental status of these wonderful people? They're like angels inside the ICU and in the hospital.
So well said. I'm sorry, this audio is very, very difficult for me. I've been really gathering all my strength to hear what you're trying to say. So apologize if I have not heard you right. Probably I understand that you're asking us what is it that makes the nurses so strong to come to work and take care of patients, especially you've described a situation where the nurses would be asked by the patients to save their lives. Yes, sir, I would say that the organizations have, fortunately, in the last few years, focusing on the mental health and wellness of the frontline healthcare workers, because they know that there is burnout, there's trauma, there is this emotional baggage people carry, and sometimes nurses and doctors feel like second victims. So I think the last few years has seen some kind of investment into psychological well-being, managing stress at work, preventing burnout, and a whole host of wellness programs that have been brought in. So I think somewhat we had started to walk the path. Nevertheless, I would never discount the mammoth task that was in front of us, where we had to step in with courage, not knowing what's going to happen to us. And we've seen that a lot of people were torn apart when there were these mass deaths that were taking place and the country was torn apart. It had a psychological bearing on every single person. But I'm sure, we've learned this, that we have to conduct constant well-being programs. We need to talk about stress. We need to talk about our feelings. There have been helplines. Fortunately, doctors came together, nurses came together. This pandemic has united the entire world, where even nursing associations from the more developed countries came together to help. And I felt even sometimes just speaking out in a group or speaking out what you went through, venting out these kind of issues, have seen that people have been able to cope with this situation. Because coping with emotional anxiety and the situation has been a big stress for the entire workforce. And I'm glad everybody is now walking up and seeking help.
Yeah.
That stigma that we talk about is probably now slowly evading away from our healthcare workers, and every organization is sensitive to it. As such, we work in oncology, pediatrics, neonatology. I know while we celebrate the miracle of birth, we see a lot of death, and we stand in with dignity to support that.
True.
And I think in the days to come, psychological well-being and mental health, both for families, for our frontline healthcare workers, for administrators like us too, matters a lot. And I'm sure this is going to pave way to see that this is going to be a new frontier for all of us. And we will all be benefited with the psychological support systems that might fall into place.
Thank you so much. Thank you.